cancer is one of many non-communicable diseases, or NCDs, that cause millions of deaths worldwide each year. Experts say the number of deaths and disabilities attributable to NCDs is rising, with the greatest increase in low- and middle-income countries. Joining us on the phone from North Carolina to tell us more is Dr. Sidney Smith, president of the World Heart Federation and a professor at the University of North Carolina at Chapel Hill. Dr. Smith, welcome to In Focus.
Thank you, and I think you focused right on the key point that if you look at heart disease and stroke, which are the leading cause of death around the world, and add to it cancer, another major killer, diabetes, and lung disease, the 36 million deaths in 2008 are going to go up to 52 million by the year 2030, and the 80% of these deaths are occurring in low and middle income countries, which can not afford the tremendous burden that it's placing.
Indeed, Dr. Smith. Now, why do you think that this is happening in low and middle income countries, this increase?
We have an increase in risk factors. We see an increase in smoking, tobacco products. We see increase in hypertension, increase in obesity, change in dietary patterns. There are 4 or 5 major risk factors that are increasing, and at the same time, there are not facilities in place to detect the risk factors or provide cost-effective treatment. Now, some of the treatment is things that we can do. Don't smoke. Don't use tobacco products, whatever that is, $3 or $4 a day in the pocket of everyone who decides not to do that. Eat healthy foods. Exercise. Many of the things that can be done could be done at very low cost.
Now, are there some treatment, you just mentioned some actually prevention steps, but what about in terms of low-cost treatment specifically? Are there anything that are available to help address that?
Well, this is why the World Heart Federation and the NCD Alliance are so supportive of the work at the United Nations, the big conference coming up in September, where we really want to see overarching goals established. If the United Nations will act on the World Health Organization recommendation to reduce non-communicable disease by 25%, we will get the local programs. We will get specific timelines and goals locally. For instance, high blood pressure is one of the major risk factors. If people that are going into clinics already set up for malaria, AIDS, and tuberculosis had their blood pressure measured, got information about smoking cessation, we'd be well on our way. But we need these programs. We need the support of the United Nations, and we need a much stronger mandate to come out of the meetings in September than is currently planned.
So quickly, in 10 seconds, give us 2 main objectives that you hope to accomplish during this meeting.
The major objective is to get agreement on specific goals and endpoints. 25% reduction in non-communicable disease by 2025. We want specific goals and timelines. And secondly, we'd like to see a focus on the risk factors of tobacco, hypertension, diet, exercise, and have some cost-effective medicines available.
Great, Dr. Smith. Thanks for joining us today on In Focus.
Well, thanks very much for your support. It's a pleasure.
And that was Dr. Sidney Smith, president of the World Heart Federation.
And yeah, I have to thank you very much. That information is really beneficial, and especially to know that there is an increase of non-communicable diseases in our countries. We hope something can be done. Thanks a lot, Linord. And remember to watch for Linord Moudou's health reports every Tuesday and Thursday right here on In Focus.